Okay, so starting with the antenatal care of diabetes mellitus, the preconception care has already been done. Any woman who is having type 1 diabetes mellitus, right? Like any woman who is having type 1 diabetes mellitus or type 2 diabetes mellitus and GDM who are on multiple daily insulin regimens, they should monitor their blood glucose levels in the fasting period, pre-meal, 1 hour post-meal, and at bedtime. But those females who are having type 2 diabetes mellitus or who are GDM, if they are in on diet control or exercise, or they are using single dose intermediate or long acting insulin, then they should check their glucose at the fasting level as well as on the first hour post meal. The important point is that if any female who is using insulin or who is using glibenclamide, her glucose levels should be above 4 millimole per liter, right? Monitoring of the HbA1c levels. So all females who are known to be diabetics, they should monitor the HbA1c levels at the booking so as to find out who are at greater risk during pregnancy. Consider in all pre-existing diabetes mellitus females in the second and the third trimester also to assess the level of risk in pregnancy. Number third, all GDM females at the time of diagnosis should have their HbA1c levels checked to rule out any existing type 2 diabetes mellitus and do not use routinely the HbA1c levels in second and third trimester. How do you manage diabetes mellitus during pregnancy? Well, if a female is on insulin, she is at a higher risk of hypoglycemia and she may be unaware of the signs and symptoms of hypoglycemia. So you have to counsel this patient regarding it, right? Okay, counsel the patient that rapid acting insulin, that is Aspart and Lispro, is a better insulin as compared to the human insulin, and that the risk of hypoglycemia will be present with these females. So if those who are type 1 diabetic should use the glucagon, and the patient as well as the family members should be counseled regarding the use of the glucagon. And then any female who is on insulin treatment for the diabetes, she should use the glucose tablets and glucose containing fluids along with herself, right? Offer women with those women who are on multiple daily insulin regimens and who cannot control their blood glucose levels, they should be put on the regular subcutaneous infusion solutions, right, for the control of their blood glucose levels and without causing significant hypoglycemia.